okay, actually participates in supination.
Makes sense.
By virtue of where it attaches. And then the supinator. The pronators are going to be pronator teres and pronator quadratus. So they tell you kind of what they are. Okay? So if you've got three, have you ever like seen, you know, elbow curls? You can do them in a few different, you know, you can do it with your forearms in different positions. Why do you think you do that? It's to work all the three muscles, right? Okay. Here's a summary of your nerve. So it gives you kind of the name of the nerve and then the spinal segment that it comes from. The big ones are going to be the ulnar, the radial, and the median nerve in the forearm. Those are sort of the main ones that we're going to focus on. So basically, radial is this part of the forearm, is the posterior forearm. Ulnar is the ulnar side of the anterior forearm, and median is the radial side. So we use a force couple. Remember we talked about force couples in the shoulder. We're going to see that again in the elbow, or in supination. So supinator and biceps work together to move the radius around the ulna to produce supination from a pronated position. Okay, so we've got two muscles that are doing the job. That's what that's saying. Okay. Wrist and hand. So again, just be reminded that we've got all of our little carpal bones, and then they interact proximally with the radius and ulna and distally with the metacarpals. Okay, as we're talking about hand things, metacarpals being the beginning of it, okay, typically we number the digits. So 1, 2, 3, 4, 5. If you've got 6 or 8, we'll talk about that later. Okay, so the thumb is always 1, so it's 1, 2, 3, 4, 5. Okay, so nomenclature, you know, is like, you know, so you can say digit 1, digit 2, if you're, you know, making a note in the medical record. You know, the other thing that you want to do is, you know, you can say thumb, index, middle, ring, and small finger. But in the medical record, don't write it as pinky finger. It just doesn't sound professional. Say small finger. Okay, or digit 1, 2, 3, 4, 5. Okay.